My name is Samantha Houston. I like to go by Sam.
Okay. And so, talk to me about what your pain was, how it came about, and what your frustrations were before you ever got to Reset Pain Management.
Okay. So I was about 22, 23, and I was smoking marijuana very heavily. And I decided, I was like, I need to stop. This is just too much. It's very expensive. So I did. And that was when I noticed that my leg and hip just hurt. It hurt to sit in a car. It hurt just to sit. It hurt to exist. And I had no idea. I was just completely using marijuana to just cover that up and just didn't even really notice it was that bad. I was having to get out of the car and like stretch my legs on car rides and just didn't think about that. So I started pushing to, go see a doctor. I was still on my dad's insurance. So I was like, I should do this while I have insurance. And so I was going, and I was saying my hips hurt. So I was seeing a hip specialist, a hip orthopedic surgeon. He wasn't finding anything wrong. He wasn't helping me. He was prescribing me every anti-inflammatory to try. Nothing was really touching the ache, the really deep ache that I felt. Like it was just an untouchable pain. It was definitely, it just wasn't something that anti-inflammatories were reaching, and nobody was giving me any answers or solutions. So I think I waited like another year and a half, and then right before I was 25 and gonna lose my dad's insurance, I was like, I gotta go again. I can't. So I made an appointment with the same orthopedic hip guy, and he actually had called out that day, and they wanted my $40 copay, so they weren't gonna like reschedule me. So they had me see a back specialist who was like his friend. So they were like buddies, and he like looked at my x-ray and looked at me, and he was just like, you're in pain. And like, I don't even know what he saw. I don't know if maybe it was my SI joint or something, but he was just like, it's your back. Like, it's causing pain to go down your leg. It's your back. And so I at least knew, okay, well, it's my back. Then I was off of the insurance. I was using marijuana again to lean on my pain. I've got approved for Medi-Cal, thankfully, especially because LA Care, I think LA Care had just started at the time. So LA definitely has, it's a very decent insurance. I can't speak for anything else outside of it, but I do think I'm very blessed with LA Care. And so I went and found a primary care doctor. My primary care doctor was incredible. He instantly believed me, but I did show up with a stack of papers and in tears and just like, I'm in pain, but because I'm like under 30, nobody will even like listen to me. Nobody, and nothing's showing up on the x-ray, nothing's showing up on the MRI. So like nobody, so he had me go see a couple back orthopedic surgeons. Same thing, they weren't really helping me. I had one who gave me my first shot. And we're just like sitting there and I'm explaining the pain and he goes, okay, lay on your stomach. And then he goes like, he starts pushing on the area. It's my SI, it hurts. It's my SI joint. I'm like, this is painful. He goes, I'm gonna give you a shot. And I was like, what? Like, no, I had never had any kind of cortisone, never had anything like that done. And he just like stabs me. And then he's like, okay, the liquid has to like slowly seep in. So just don't move, okay? And like, I'm just like laying on my stomach. Nobody prepared me. And so I'm like holding my breath, absolutely just terrified. I was just so scared. There's just this needle in my back. He took it out. I don't even know if I don't even remember if it helped me much. And he just gave me like one little stab. He didn't prescribe me anything, and he wasn't even like it was just like it was a random orthopedic surgeon. So actually then was when that orthopedic surgeon made me go get what is it called when you're pregnant and they give you, the epidural. So when your SI joint is in pain, they can't diagnose that your SI joint is the cause of the pain without actually putting a numbing thing in the SI joint. So I had to do 2 of these. I had to lay down. I wasn't allowed to have any kind of being knocked out. I had to be 100% conscious. And first they have to stab you with a dye to make sure that they're going to eject you properly. So I'm laying on this thing, and it's like a school, because I'm like a Medi-Cal, so it's like a cheaper or whatever, they're students. I was like, yeah, that's fine. I start, like, he's poking me with the dye needle to like get into the SI joint. I'm already in a bunch of pain. Nobody prescribes me anything. Nobody's helped my pain. And he's just literally irritating it. And it was the worst excruciating thing I've ever, I was like screaming. I've never experienced anything like that. But once he finally got the actual needle into the SI joint and put them, why they can't give you anything is because it's only numbing for like the first hour. So like it's literally just a diagnosis shot. It's just to make sure this is where the pain is located.
Yeah.
So it did work. I like was completely pain. I was like, for the first time, it was like probably adrenaline too, but it felt like a completely gone. I was like, oh my gosh. And then it like completely came back. But having him poke me and irritating it that much, I knew it had to be super inflamed, and then it just wasn't hurting.
Yeah.
So I was like, okay, so maybe it's my SI joint. So then I go back to the primary care doctor. It's my SI joint. So he sends me around to a couple other doctors. I'm still not getting a solution. One guy was talking about fusing my SI joint, giving me this thing called an iFuse, like rods in my back, rods in my hip to like hold the little like thing in place so that there's no inflammation that can happen in your like SI joint. I don't know. I was ready to like go down that route. And then my primary care doctor goes, how do we put you in pain management? I can now request pain management. We've done enough. You are clearly in pain all the time. Let's get you to pain management. So I come here to pain management. I think I had to be like 26. No, I was like 26, 27. That was a really long, that was like so many doctors. That year was crazy. I have so much paperwork just from that year. So I come here and I'm just like, it hurts. And I'm all scared because I don't know what pain management is. I don't know what this means. Like, I don't know, all these nobody's helped me. Like, are they gonna help me? So I come in, and Dr. Khoury is like the sweetest gentleman. I show him all my drawings because I don't know how to explain my pain. So at this point, I've been drawing it. And that's when I'm like, it's my inside joint. It goes down my leg. It hurts. I don't know. And he took me to a different room for the shots. So that was already like a significantly better experience. It was like a clean, sterile room with like an actual machine, double checking the needles going in the right spot, and another person there. Like, it was just a completely different, better experience before the shots even happen. So it takes, so I go into this room and like, they give me the shots and I'm like sitting there, just like terrified waiting. And he was like, done. It was just like this super quick, like, do. And like, I didn't even have like the freezy spray, nothing. And it was just like, I couldn't believe it. I was like, the last guy like spent like 5 minutes, like just letting it stand there. And so that experience, just experiencing the shots better, was just already major. And I didn't actually think it was gonna help. I was like, that was a lot of shots, but who knows? I didn't really notice too much for the first couple days, but I do remember that I lived in a house with friends and there was a bunch of people over, and I went out and hung out in the living room and like actually hung out and I don't know, it was like I was all of a sudden like I got to like be like the part of me that was social that was like taken away was all the like, it wasn't back, but I was like being social. And even my friends noticed. They were like, oh my gosh, like how are you, like how, and I'm like, I'm okay. I think I'm feeling better. I was like, I don't know though. I don't know. It was a super weird, but since it hurts when I sit, I was like, I could sit. I could sit. So like that already was like, oh my gosh, like this is a game changer. So I got to have my life back all of a sudden when I first came here, because before it was just going to doctor appointments and laying in bed.
Yeah.
Like that was it.
So you literally had to lay in bed because it hurt to sit, it hurt to walk, it hurt to do anything.
It hurt to do anything. And the only thing that the orthopedic surgeons had told me was just avoid things that make it hurt. But how do I, like, what do you mean avoid things that make it hurt? Like, it hurts to sit. Like, it hurts. I can't go lay down. Like, my job, thankfully, I was a friend I was working with. He was the manager. But, like, I would go lay in my car sometimes. Like, I would just have to be able to lay on my back and, like, let all the muscles relax. Like, it was, it was hard. It was hard. You can't just not sit. Like...
Yeah, that's most people's version of doing nothing is sitting.
Yeah. Reset pain management allowed me to have my life back.
Okay. Before reset pain management and after reset pain management, what were the differences?
Before reset pain management, everything was taken from me. I used to bike. I used to love driving around. I had no problem driving around, but I couldn't drive myself places. I had to be the passenger unless it was like a 10-minute drive. But if there was traffic and I had to sit there, being forced to sit with the steering wheel and like with my feet, it just didn't work well at all. So I had to have people basically pick me up or drive me places, and I was no help around the house. I wasn't going to waste any of the energy I had on cleaning because I had to work part-time. So any energy was basically just trying to get to work and hopefully make it through the day. Most of the time, it was hard. It was really hard back then. It was a lot of leaning on marijuana because I didn't know how else, because I had to work. I had to pay rent. So I had to like just push through it. But then at that point, I couldn't do anything after work. I couldn't do anything before work. I couldn't do anything on my days off. Grocery shopping was really, really hard. And that was before any kind of online, like I couldn't get my groceries ordered. I would like have to go, and like grocery shopping was probably one of the hardest tasks. Like just being in pain, walking around, and then having to be around people while like being in pain. It's just a lot. It's a lot. So
why don't you talk now about after reset pain management? What does your life look like now compared to that? So
after reset pain management, I am able to get up and function. I don't have to plan my day around my leg. I don't have to plan my day around my pain. I still have to be aware of it, but I can do things. I can drive myself places. I get to go camping now with an air mattress, but I can go camping. I can go on a hike if it's not a crazy uphill. Like I can do a 2-mile hike. Not a lot, but I can do a 2-mile hike, and that's like, it's huge. It's just being able to like go places, like driving, like getting to places was so hard, and now I'm able to do that and not have to like rely on somebody else, and I'm able to like go out and see friends. If I want to like plan that out, I can go out and have a night out and see people, and then that's something that like I couldn't do before.
That's awesome. So if someone's thinking about maybe trying to reset pain management for any, because this technique works for anywhere. I mean, it works for your pelvic floor, it works for people's hands and arms and feet. So like, what would you say to recommend why they should try this reset pain management treatment with Dr. Khoury?
I would say to just try it, because when you are in pain, regardless, it just gets really hard, and your whole life becomes about your pain. Everything is constantly your pain. So it's, I feel like most people who are in pain though are willing to just try anything. So I say just give it a try. For me, trying it, it's been so helpful. And Dr. Khoury alone though, like, he's just really good at what he does. He does the shots quick. He does them efficiently. he even, he knows to distract you if he's doing a new spot, and like he's very good at them, and he wants to make sure to help you. And like you get a call from the office a couple days just to check on you, just to ask, because they want to document, is it a little different? Has your pain helped? Has it changed at all? Because sometimes for me it won't be too immediate in my back. It'll take about like a couple days or a week to kick in. But since he started doing the ones by my pelvic floor, those kick in pretty much in the same day or two. So the pelvic floor ones, I don't know if it's just how the muscles work right there, maybe because that's like directly where the pain is instead of where the back has to travel. But the inflammation in the pelvic floor is almost immediately a noticeable difference. So
that's awesome. And how many treatments and other things that you tried do you think before you got to reset pain management?
Oh my gosh, so many things. The physical therapist will always help for like the first 2 months, but the physical therapy always ends up pushing me a lot. At least when I was going for my leg pain, physical therapy was just kind of pushing me. They really want me to be better. Like I had to be like, the little bike thing, I can't go on that. Pushing my feet, something like it irritates my leg. I know what is going to make it more inflamed faster. So physical therapy just would push me too hard. I knew my limits, but they didn't care. They think that they can fix it with like your muscles being in shape. I have no idea. So physical therapy was hard because it would help me and I'd be so excited and be different. But then all of a sudden we'd get to a point where they were just pushing me too hard, and then I was just inflamed even worse. So like that wasn't helping. I attempted a chiropractor once, and it was okay for like 2 days, and then it was like not okay at all. And so I was like, I'm not trying that again. And like, no, we're not doing that again. And I've tried a bunch of natural remedies, always looking at like, I do love turmeric now. Turmeric is a great natural anti-inflammatory, but those don't touch the deep, horrible aching pain that like starts it all. Like those don't hit that. I have like a massage gun and a heating pad and ice pack galore in the freezer. I still use those things now, but that was what I was told to use, and they only help so much.
Yeah.
So I went 1 year without pain management during COVID because of insurance switching, and I had just started seeing a physical therapist who was actually helping me a lot. I was really he was just very helpful, and he listened really well with my limits. He wasn't pushing me. So I really enjoyed it. I was like, okay, let's give physical therapy a try. Let's see how this goes. He really wanted to help, and he, at their practice, had just started addressing pelvic floor physical therapy, and they had a lady who had trained in it. And so he was like, it might be helpful for you to see her. We can't he's like, these pain, and then like also like it's like my butt like that hurts, so massaging that's like just weird on their end. They need to you need to be like verbally approving that it's okay that they're even near there. So seeing the pelvic floor therapist took away that so I saw her, and that was a game changer for me for everything, because I didn't realize I wasn't properly relaxing my pelvic floor. And even with her just helping, being able to like massage the outside, being able to massage the back, being able to show me what muscles are tense there, she taught me so much. She did do stuff internally, but she gave me the tools to do all that stuff myself, so I don't have to remain going to her. I went back to pain management. I went back to Dr. Khoury after a failed pain management with a different doctor attempt that was just, no, we're going back to Dr. Khoury. I'm not even gonna try. So I come back here, but I come back here with the knowledge, like it's my pelvic, like there's pain near my pelvic floor. What can we do about this? And he goes, well, let's try it. Let's do a shot right there and let's see if there's a difference, because it had, was getting worse. Even with me properly relaxing, there's definitely, a month or two that were really, certain positions with my partner were just not okay. And it was a weird pain that just never, I had never even thought to like look at those muscles. So when Dr. Khoury started giving me the shots there, it's been a game changer. I still get them in my back but I get them there as well. And it's been amazing. And I hope that somebody else can be helped with that and possibly realize that maybe that's where their hip or back pain could be kind of coming from.
Yeah, it's interesting. You said not a lot of people talk about it, but it's such an important and big muscle.
It's such an important big muscle, and it's holding all your like things inside too. Like it's an important one. And like, I mean, vaginas are crazy like organs or muscles, and like that's a part, like the pelvic floor, like that's a big part. I just learned I was never relaxing properly ever. And like I remember physical therapists like telling me to like, hold my muscles a certain way, but I never really understood until I saw the pelvic floor physical therapist, and she was like, no, like we need you to like actually relax.
Yeah.
So I'm just thankful for Dr. Khoury. I'm thankful that he listens. I'm thankful that he cares. Being in pain while being younger is a very difficult experience because a lot of people aren't perceiving you in pain, and it doesn't mean that your pain isn't happening. So Dr. Khoury has just always made me feel okay with that. Like he wants to help. He genuinely wants to help.
Yeah. So you think some doctors thought you were like trying to get like their pain medication?
Well, I was going in, so that's what it started to feel like, because I was going in and they would give me different anti-inflammatories to try, and I wasn't going to have insurance much longer, so I'm scheduling to see them over and over, and he's just like, this isn't helping. But I also just didn't have a primary care doctor. I was just seeing an orthopedic surgeon. It was like, it was in my early 20s, so I don't even think I cared to have a primary care doctor, which I think would have been smarter to just have one, because that would have been another doctor advocating for you. But since I was young going in, this isn't working, my MRI is coming back fine. Like there's a little bit of deterioration, I think, on something, but it's like nothing that would be causing this kind of pain. And the x-ray was coming back fine. So it was just like a repeated trying to get help, and nobody was giving me anything helpful. So, but at that point though, those doctors they didn't even push physical therapy. Like it wasn't until I saw that back doctor who started pushing physical therapy. They just didn't seem to care, but I didn't have anything to compare that to. So I didn't know that wasn't the standard.
Yeah. Because
my primary care doctor and Dr. Khoury cared instantly. They looked at my paperwork. They didn't it was just different. It was different. I recommend Reset Pain Management for anybody who's dealing with constant chronic pain. Dr. Khoury gives you your daily life back, and that's the point of pain management. Pain management is supposed to be giving you your daily life back, and he does his best to make sure he's accomplishing that with you and your pain. Every single time he is setting up the shots to be exactly where you're feeling your pain, and that's, I think, is a big help. So
awesome. Thank you so much.